Se llama Naira McDonald, es actualmente el responsable del sector sanitario para Europa Occidental en Microsoft. Decir que viene de una familia tradicional de médicos, posee una trayectoria bastante dilatada en el sector público con más de 10 años de experiencia tanto en grandes y pequeñas organizaciones relacionadas en el ámbito de la salud, y anteriormente fue consultor estratégico en Accenture, licenciado en negocio internacional y también en contabilidad estratégica. Su ponencia versará sobre la transformación digital en sanidad y la visión sobre cómo potenciar los sistemas sanitarios más capaces. Tiene la palabra María.
Gracias, thank you very much. So, thank you for taking the time out of your busy schedules to let me come and speak to you. I'm very honored to be invited by the Sociedad Española de Informática de la Salud. That's my only Spanish for the evening. I believe there are headsets for people who, there's an interpreter. So if you need the headsets, I think there's a gentleman at the back who can share those out with you. If you want to do the English oral exam, then that's fine too. Okay, so why am I here? So I maybe what you can do also is tell me if I'm going too fast. Just go like that, and I'll try to slow down. I tend to get a little bit excited sometimes, and then I speed up. Okay. So as was explained, I work for Microsoft. I've worked there for 13, 14 years. My current role, most of that time I've been working in the public sector, different parts of the public sector, but mainly in the public sector business. Before that I was a consultant at Accenture. So I guess what I'd like to say at the beginning is, my passion is problem solving. That's really all my career. If I think back about my career, it's all been about trying to solve problems, whether it was as a consultant, trying to understand the client's problem and then trying to design a solution. When I entered Microsoft, I actually ran the technical support for Microsoft in Western Europe for a few years. Again, all about trying to solve problems. And actually, when I think about this job, this is the ultimate problem-solving job. The ultimate problem-solving job. Because there are no problems more important than the problems we solve in healthcare. And I think what's fantastic about this meeting is that on one side we have technology companies who are building capabilities, whether it be capabilities in the hyperscale cloud, whether it be capabilities around machine learning, capabilities around Internet of Things. But they're not the health professionals. They may have an understanding, but they're not the health professionals. On the other side in this room, we have the health professionals, who may not understand as much about the technologies, but they understand the problems. They understand the problems. If we can get those two groups to trust each other and to start partnering together, I believe that we can solve many problems. And I see my role, and I see myself today here not so much as a Microsoft guy. Yeah, I know the Microsoft story. I'm going to give you our perspective, but I see myself as a representative of the technology sector. When I looked down here, many of these companies are our partners, and we're not going to solve your problems with just Microsoft solutions. We're going to solve them through partnership with you on your innovation agenda, and we're going to solve them by actually various technology companies coming together and being humble enough to admit that they don't, on their own, have the whole solution. And so that's a little intro. try to find my PowerPoint, that would help. All right. So what I'd like to do is really give you our perspective as Microsoft on the health sector and where we think we can add value. And then what I want to do is, I want to talk about real examples. So I want to tell you about some of the technology, but looking at the technology from the point of view of real problems that we're solving today in hospitals. All the examples that I'm going to describe are examples of work we're doing with hospitals in Europe. Because I know sometimes technology companies bring lots of amazing examples of things they're doing in USA, and our customers are often scratching their heads and going, but is that really applicable? So I'm pretty sure that everything that I have in this deck relates to real life customers, real life hospitals in Europe. Okay, but I'm going to start first with our perspective. How are we doing on the clarity? Okay, yeah. Okay, good. All right. So, I guess our first perspective is that IT in the health sector has been very dominated by this systems of record. Systems of record is really how IT collects information and records that information. So your classic systems of record in the health sector are your electronic health record and your PACS system, your system for your medical images. Okay, and what does it do? It ensures that we keep that information on the patient and the clinical information relating to that patient. The challenge has been that ultimately, most of that information isn't very actionable. Okay, and increasingly we see our customers wanting more on this side over here. Systems of engagement and systems of insight. Systems of engagement, really, how do we enable our care teams, which are increasingly becoming multidisciplinary care teams, to collaborate better together. But also, it's how do we enable the customer, the patient, to engage better, okay? And indeed, how do we enable the care teams within a hospital to collaborate and coordinate with the care teams who are outside the hospital, who meet the patient, in their ongoing, so the GP, as we call it, the doctor who meets the patient on an ongoing basis in primary care, the care that happens, social care, elderly care, etc. How do we enable that end-to-end engagement? And the other part is systems of insight. So how do we actually take all of that data, and one of the issues with that data is that we typically, when we actually want to get insight from the data, we find that the data is sitting in different places. It's not all in the health record, and even, to be honest, what is in the health record is often not very well structured, but it's actually in different repositories, and that makes it very difficult to actually derive insight. So insight on actually what's happening with that, with a specific patient or with a group of patients. Insight about the hospital and the throughputs of the hospital and what's driving the costs of the hospital above the budgets of the hospital. So really what we see is this is where the investment went, but this is more increasingly where the problems lie. Okay, and that's going to be a kind of an underlying theme for the rest of the presentation. One simple example to bring that to life. So this is actually a screenshot of an electronic health record system. It's from a provider called, an electronic health record provider in the Nordic countries called Cambio. So you're within the electronic health record application here, but what's interesting is they built Skype, they've embedded Skype within the electronic health record. So that's that notion of, okay, we've taken that system of record, which is the Cambio electronic health record, but we put some ability to engage directly with the patient electronically, to engage with other members of the care team. So it's a tactical example. It's far from the whole story. And where we're going now with Cambio is really to say, okay, so this is a good step. You've got some ability to engage. Now, what can we do in terms of wrapping analytics capability around that electronic health record? And more of that in a while, and how we're doing that. But it was just to make that point that even the providers of the electronic health records themselves are realizing they need to move across this bridge into engagement and insight. Okay. So, going to be a little bit controversial here. This is how we see the current cycle, healthcare cycle. So it's very much, person starts to feel ill, they go and see a doctor in primary care, they go to the hospital gives them some information, or they give some information to the hospital, they receive some treatment, they leave, they recover. Now there's a couple of things, about this as a process. The first issue about this is that it's reactive. It's a whole system that reacts to the person feeling sick. There's no part here of preventative, right? There's nothing, we're not getting in early enough to actually understand maybe how we prevent them feeling the symptoms. We're only reacting, okay? The second part of this is that ultimately, if we can't actually understand prevention, we actually, it makes the system inefficient, because it's very, very hard to understand the volumes, right? Because we're not on top of where the volume of patients is going to come from. We're just reacting. This thing is moving at me. Okay, let's just go back for a second. Hopefully. There we go. Okay. So the second thing is, it drives inefficiency because essentially we react, and it's very hard to control the throughput, the volume. The third point is that typically the different stages are disconnected. Okay, so this part seeing the doctor and this part giving information to the hospital, they're disconnected. This part about receiving treatment at the hospital potentially, and recovering, which may be happening outside the hospital, they're disconnected. So it's reactive. We don't control the volumes, and on top of that, the different elements are disconnected. And for the most part, if it's disconnected, that means that the patient tends to get a poor experience, because one reason they're having a poor experience is because they don't feel that what's happening here is necessarily connected to what's happening down here, and often they're giving their information multiple times. Okay, so we tend to say this is more of a sickness care system as opposed to a health care system, a sickness care system. Okay, so this is what we see around how things are going to evolve to. So first of all, a big part of this is proactivity, prevention. Okay, so what can we find out about the patient that allows us to get involved in prevention and actually get involved early enough in the cycle? We know that if we get involved early enough in the cycle, we can actually have better outcomes. And we know that a big part of how we'll get involved early enough in the cycle is to personalize, so much deeper understanding of the individual patient, both their health record, their ongoing lifestyle, and also their genomic, their DNA profile. All of these things will allow us to understand essentially the likelihood of sickness occurring and starting much more preventative things. The other thing we want to do is we want to have this ongoing capability, okay, this ongoing ability to monitor, whether that be monitoring before there's any specific illness or monitoring of a specific illness. That monitoring is a key input to allowing us to understand the risk profile of a patient for a specific illness. And we want to do that. What we also want to do is we want to connect that consumer, so the consumer will know that customer, that patient. But we think of a patient when the illness is diagnosed. So what the word should be, but the key point is that individual, that citizen, can be connected at every point, so they can understand their likelihood of contracting an illness. They can understand the treatment path that they're on. They can understand how they can, the choices they have. They can understand their own personal health record. So it's really that it's interesting the way my slides seem to have a life of their own. It might be because somebody's telling me to hurry along. And finally, we want the different partners to be connected with each other. So the partners inside the hospital, the players inside the hospital, the clinical care outside the hospital, but also the partners who are potentially collecting information, whether it be through wellness devices, etc. So it's an ongoing cycle that we think is going to be the future. Okay. So, last slide on kind of our perspective. So we essentially think about the health vertical, and indeed, each vertical that Microsoft supports in a couple of ways. The first is we think about the entity, so the hospital, okay, and its interaction towards its customers, its patients, okay, and what we can do around that. The second, this is engage patients and customers. The second one is within that entity and its ecosystem, what can we do to empower and enable better collaboration? So how do we create more empowered and capable care teams within that health ecosystem? The third one is around analytics, so how do we use data to drive more efficiency and better outcomes? And the fourth one, transform health. That's really about, hey, one thing is improving the processes and the productivity, but actually, can we actually, with these technologies, essentially change healthcare, right? What is healthcare? Actually, how healthcare is done, how we actually, diagnose, how we do surgery, how we actually get outcomes. To what extent can we transform the very core business of healthcare? That's the fourth category. So you're probably going, that's a lot of theory. That's a lot of theory, okay? It is, right, but I was asked to explain our perspective, so that is our perspective. I think one last thing before, and I'll move off the theory then. Microsoft's background is very much in three things. One is productivity, so how do you actually help, all workers to become more productive, to use their time more effectively. The second one is collaboration. how do you get a team to work better together? And the third one is around platforms. So for many years we built these, these platforms for infrastructure, okay, for databases and for operating systems. So that's what we have done. And so what we've tried to do is we've tried to take these historical strengths of our company and apply them up here. And that's where this notion has come from. Okay, so let's talk about engaging patients and customers. Okay, so let me go back a second. All right. So a couple of ways, a couple of things we'd like to achieve, a couple of problems we'd like to solve through better patient engagement. We'd like to reduce delays. Okay, we'd like to actually ensure that the patients can get the information they need when they need it, and that they can get the care they need when they need it. So there isn't this delay. Reduce delays. A second one is improve the experience. So the actual experience the patient has of healthcare, of the healthcare experience. A third one is ongoing. Move from periodic engagement to ongoing engagement. And the fourth one is that patients should feel a stronger connection to healthcare. So they should feel actually, I can have an ongoing relationship as a patient with my healthcare provider or set of providers. Now I'm going to talk now about a few examples here. So on a very practical level, but this is the SPMS, so the shared service for IT in Portugal. Now they're at a relatively early stage, I would say, in their digital transformation. But what this is an application they built on our platform, and it's all about accident and emergency. So what they realized was that they have a number of different accident and emergency centers around Lisbon, as an example, but the input wasn't very balanced. So at certain times there'd be one that actually had very low throughput and another that was completely backlogged. And of course the people were arriving at this hospital and they had a delay of 1 hour, 2 hours, 3 hours, and over here actually you had underutilized clinical workers. So what they did is they essentially took the real-time data on waiting times from the registration system in the hospitals, and they made that available in real time. So they simply have an application that's a mobile application that if you have a problem and you need to go in, it'll tell you these are the accident and emergency centers that are currently online, that are currently available, and here's the waiting time at any point in time. Very, very, very simple, but makes a great difference in terms of balancing supply and demand. Okay, for that particular branch of the hospital services. Next one, I thought maybe time allowing, I'm going to try to play a video on this one. This is about stroke care. Stroke, so when you have essentially a bleed and it affects your brain function. As we know, it's all about the speed at which you can react in stroke care has a huge influence on the outcome for the patient. So let me show you this video. Let's hope it works. How's the connectivity in Merida, huh? Give it another few seconds.
We started using telemedicine as a system to assess patients, particularly out of hours, back in 2011. And the initial system wasn't ideal, so as you were trying to assess a patient from home, the picture would break up and make an assessment of a patient very difficult. So we were seeking different solutions, and that's when the IT team started working with the Microsoft system.
What we wanted to do was find a system that was intuitive, good value for money, and was going to deliver the speed benefits that we knew telemedicine could deliver. So we chose Skype for Business because it ticked all of those boxes.
The difference assessing a patient was amazing the first time we used it. The quality of the pictures is so good, it means that you feel like you are almost in the room assessing the patient, because you can see how they can move their arm, you can look at their face, you can assess their speech, and that's made it extremely useful and user-friendly. Out of hours, the stroke consultant won't always be on site, and they used to have to come into the hospital to assess patients, which uses a lot of time. With the new Microsoft system, we can be contacted at home, assess the patient very quickly, and this means that the patient is likely to do better than we may have expected before, because we know that if you treat people quicker, less brain cells are affected, and so you're likely to be left with less disability.
I had a stroke on Sunday morning, 6:30 in the morning, very bad time, and so there was a computer screen at the end of my bed, and the consultant, Dr. Kane, appeared and asked me to do various actions which I was not terribly able to do. You lose your neurons very quickly, so the treatment I got meant that I wasn't waiting, and that meant that my recovery was more easily attainable, because without it I think I would be not as good as I am now.
It's staggering, the difference in cost between this off-the-shelf product and a more commercial, standardised telemedicine offering. That's really important for me because it enables us to take all the benefits and deliver them to areas around the trust that probably wouldn't normally be at the top of the list for telemedicine. It's a standardised product, it's easy to support, and that delivers fantastic clinical benefits.
I'm passionate about stroke care, that's why I'm in the job that I'm in. I always want to do a better job, and part of doing that is being able to see patients as quickly as possible, and this system allows me to do that, which means that I don't feel I'm disadvantaging people if they don't happen to turn up 9 to 5 Monday to Friday.
Without telemedicine I might well not be at all as well as I am now. I'm very, very fortunate.
Okay, so hopefully that came across clearly enough to you. The point being that using Skype for telemedicine has allowed this hospital, Brighton and Sussex, to actually create a closer connection between the stroke consultant and the patient and respond more quickly for stroke care and stroke diagnosis. The third example I want to give you is from Finland, and this is from the Helsinki University Hospital. So they have designed what's called a virtual hospital. They call it the Health Village, and what they have done is they have designed a hub for various different types of medical issue. The first one they worked on was mental health. They've now extended it to diabetes, to coronary care, so heart care, one for cancer, one for weight loss or weight management issues, and numerous more. And how this works, essentially, is that there's 3 parts to it. So each of those areas, mental health as an example, has a portal where somebody who's not a patient of the hospital can go there and understand more about the condition. They have symptom diagnostics, and they can actually look at that and then ultimately ask for a consultation directly there. Then the second part is for doctors, and it's actually for doctors to go in and to the specific area of the health hub, so whatever the specific illness is of the customer, and the doctor can understand the treatment path for that patient, and they can understand who they can do a referral. They can have a doctor to consultant discussion within that health hub. And then the third part of each hub is actually for the patient after they've been to the hospital. So they're now on a treatment path. There's a specific identifier for the patient, and when they enter the health hub, all their information is there, all their patient information, their clinical history, and their treatment path. And then they can have an ongoing interaction with the clinical team online through the health hub. So Helsinki has been working on this for about 7 years. To give you a sense, the mental health hub, they get about 100,000 Finnish people per month visiting that health hub. There's about 1 million Finnish people from outside Finland who access this service. And the way Helsinki think about it is as a digital companion. So they think we have a physical institution and ecosystem for providing healthcare, and then we have this digital companion, and the two things need to work in tandem. Okay. At this stage, it's in production. There's 16 of the hubs in production online. You can go and visit it. You can look it up if you have your laptop there. It's all in Finnish. That's the only problem. And they're going to extend this out across the country by region. So from an efficiency point of view, the information that they've given us is that the investment is very much at the beginning in building the platform, and then in putting the content onto the platform. But what it's driving down is actually their admissions to the hospital. So when they look over 3 years, if they only do a 5% reduction, and they're well on track to do a 5% reduction in admissions, they're going to pay for the investment 3 times over. So more investment in the digital capability, bring down the actual referrals, physical referrals to the hospital, and that's the business case, if you like, that Helsinki is working to. Okay. Okay, so empower care teams and employees. So this second pillar, all about how we get the care teams within the hospital and outside the hospital to work together and improve their joint productivity and provide a better care experience. First example, this is from Netherlands. This is actually from a partner of ours called Rapid Circle. So what this is essentially what they call a dream screen for the clinician. So what you have up here is, let me just point here. They go. This is the idea is this is what they log on to in the morning. Okay. They log on here. They have their email. They have their any missed calls. Over here, they have their access to the EMR system, the registrations. Over here, they have their Yammer site for discussions with their colleagues. Over here, they know which of their colleagues are online, so that they can interact directly with them, either via text or via call. Here they have personalized news relating to health. Down here, they have a specific tool for swapping shifts. So actually, if they need to move their shift from one day to the other, they can actually do that to this tool. We have about Rapid Circle. I mean, last time I spoke to them was about 6 months ago, but at that stage they had this live at over 20 hospitals in the Netherlands. So, you know, this isn't, you know, futuristic technology. This is very much a very pragmatic way of giving the clinician one place to go, and then which brings together the information they need on a daily basis. Switching gears, this is an example from the Karolinska Institute. Some of you are probably aware of Karolinska. They're very much leaders in driving consistency in surgical practice. Twice a year, they run these sessions where essentially they broadcast live surgery, and they have thousands of surgeons who log on to watch live surgery and to learn more consistent, standardized approach to surgery. What they've started doing in the last year is using a product called Live Arena, which means that essentially all the surgery is broadcast on Live Arena, which sits on the Azure platform, and then they have all that recorded. It's searchable, so they have a record. They have it live, but they have a record which is searchable of all the surgery. So it's very much collaboration here, but in the bigger way, right across surgeons, across countries, and pivoting on you know, at the leading edge of surgery, robotic surgery, etc. So, you know, great example of using the cloud, the hyperscale cloud, to enable you to share cutting edge surgical practice between the ecosystem of surgeons across multiple countries. Third one, and this is very cutting edge. So Microsoft has a specific research center. It's based in Cambridge in the UK, and they really look at, you know, leveraging very much leading edge technologies to solve medical issues. The technology I'm going to show you now is called Inner Eye, and it's all about oncology, so cancer, and specifically about radiography. So as you know, you guys know better than me, about half of us of the people over 60 today, about half will be diagnosed with cancer. And about half of those people will require radiotherapy. Now, what happens today is for the radiotherapist to prepare the patient for the radiotherapy, they have to take a large number of MRI scans, which are in 2D, and they have to delineate the tumor, okay, on multiple segments, on multiple 2D scans, and they also have to delineate the healthy organs, the parts that we don't want the radiation to affect, okay. This typically takes somewhere between 1 to 2 hours per patient to build up the 3D image of the tumor and the 3D image of the healthy organs that must be avoided. So what Inner Eye does is it uses artificial intelligence and machine learning algorithms to do this in about 1 minute or less. Okay, so essentially we take the MRI scans, we put them into Azure, and we run the algorithms, and we create the 3D image. The technology, we've been working with a number of hospitals across Europe. The technology is now going to it's due to be submitted to the FDA. It'll be the first artificial intelligence-based technology to be submitted for FDA approval. What's really powerful is, and kind of frightening when I found this out, because of the time it takes for the radiographer to do the delineation of the tumour, they only do it once. They do it at the beginning, before the radiotherapy, right? But obviously then, as the patient is given the radiation treatment, there are changes in the physiological makeup in terms of the tumour is changing, the person may be losing weight, but because of the time required, they don't actually produce, they don't actually do that again over the course of treatment. What this enables them to do is to actually do this on an ongoing basis. So actually, they customize the radiotherapy as they go through the treatment. So I think a really powerful example of how artificial intelligence can enable and really change how we do radiotherapy. Something we're very excited about. So, a little bit about analytics before you get to drinks and dinner. Okay, so obviously, as I said, we have a lot of challenges with lots of data in hospitals. What's also happening is now there's new sources of data. We have all these wearables. 10 minutes, perfect, okay. We have all these wearables. We have this ability to gather health data on an ongoing basis. So the volumes of data, then we have genomic data, huge volumes of data. So the thing is, we can gather this data, but can we bring it into one place, and can we actually develop actionable insight from this data? So I want to give you a couple of examples. The first one is one more video. So EpiMed is focused on HAI, hospital-acquired infections. As we know, this is a big problem in hospitals right around the world. In fact, personal story, my mother is in hospital in Dublin right now. She had a bowel infection, and she now has a HAI. She now has a hospital-acquired infection. So this is killing a lot of patients. So this story is from Brazil, and it's about how they're using machine learning and predictive analytics to address the hospital-acquired infection issue.
As a physician in the ICU, did you ever see a patient die and think to yourself, we could have prevented that?
Yes, definitely. Especially on the infectious disease, when the patient gets a hospital-acquired infection. Lots of it can be related to broken processes throughout patient care. You could see that sometimes processes were not perfect.
Dr. Jorge Salud, an intensive care doctor, founded EpiMed in Rio de Janeiro on the belief that by using data, healthcare professionals could improve patient outcomes.
So when you look at an intensive care patient with all the complex environment, all the monitors, catheters, literally dozens of medications he's taking, sometimes you may forget something, which is really important for this patient. I think that data helps us to put the pieces together and organize the information, helping us to apply these technologies better and ensure that the best care is taking place at the bedside for the patient. The healthcare professional in the hospital, and especially in the ICU, has very limited time. So the first thing was to get mobile. The second thing was to get information readily available real time. So it had to be cloud and mobile. Hospital IT, well, they have tons of work. They have lots of priorities. So when we bring to them a solution that does not require actual investment, either of money, servers, time, professionals, then it's kind of dream come true, you know.
So having a doctor, a nurse's aide, or whoever being able to quickly access something that the hospital doesn't have to support, that's just there for them, that's big.
You have to have internet access, that's all, really.
EpiMed's mobile solution is now being used by more than 400 Brazilian hospitals.
So far we have 3 hospitals working with us in Colombia and 3 in Uruguay. In the next 5 years, I believe that we can offer the solution of EpiMed in more 10 to 15 countries.
Today I have EpiMed solution in the intensive care units, and it brought me more organization. I could organize a unit because now I have the aggregated data to make up a strategic plan more easily with this kind of tool. I do think this tool can save lives because you can predict adverse clinical scenarios that you can correct, so you can change the direction.
They could reduce unnecessary days on the ventilator. They could discharge patients early. They could reduce infection rates, hospital-acquired infection, which is very important.
You've reduced hospital-induced infections by 21%. That's pretty impressive.
Oh yeah, checklists and the use of these tools for the best care of the patients, and looking at the data monthly, we're responsible for the decreasing of this mortality.
So 1 in 5 patients were not dying in ICU, nor were they dying in the hospital. They were going home.
That's it. That's it. As the ICUs became more efficient, they were able to take in more patients per month. The effect was like growing the number of beds by 30%. Being able to deliver data-driven care, you can actually help save lives in the end. From the beginning, we use virtually mostly everything from Microsoft, like SQL.
Okay. For the interest of time, I'll leave it there. I think you've got the idea. So that's predictive analytics capability used specifically for the area of hospital-acquired infections. Just to give you an idea, another typical use for predictive analytics has been around patient readmissions. So you can look at large volumes of data, clinical data, and look at the set of patients who actually have been readmitted, and you can start to understand the patterns. And then you can start to intervene before they leave the hospital, so that it becomes much less likely that they will need to be readmitted. So an idea of analytics at work. Very, very briefly, and I'm coming to a close, I know we're tight on time, back to Helsinki University Hospital. This is Azure Data Lake. So what Helsinki is doing is they're building a data lake, and they're sucking the information from all these areas into that data lake. National records on the citizens, electronic medical records, genomic data, data from medical devices, environmental data, and even personal health data from wellness devices, etc. Obviously a huge amount of data. You know, frankly, no health institution could ever afford to have the server capacity to store that data, let alone to analyze it. And so they're using the cloud for that, and then they're inviting 14 different technology companies to essentially look at that data and to come up with analytic solutions based on essentially looking at large data sets from different sources and actually looking for patterns. So if you like, they bring the data together, and then they can see what the potential for the analytics and the visualization and predictive modeling can be. But if you don't find a way to bring this data into one place, then you can't do that. And that's a big reason why ultimately, although many of the IT leaders will have concerns about the public cloud, you cannot do this without huge processing capability. Genomics, very briefly. This is an example from Spain. I'm not going to go into it, but this is from the Paz Hospital, where we're working. It started with a specific project on Dravet syndrome, and now we're working with La Paz to essentially support them in using Azure for genome analysis. For the most part, we already have put the basic the basic tools for snap processing, sequence alignment, and variant calling onto Azure. So it's called Azure Genomics. On average, we see a seven times improvement in speed for genome analysis using when you put these technologies, these algorithms onto the cloud. Okay, so I think a lot of examples, a lot to take in. These are all the areas where Microsoft is active, and here's an indication of the partners, a subset. The point is, this isn't Microsoft on its own, it's an ecosystem of partners who are putting clever technology on our platform. And that ecosystem is really what we can bring and want to bring to innovation. Okay, I'm going to stop there. This is about compliance. I think we can talk about, or you can talk in the roundtables about compliance. I don't know if we have time for questions. I hope you were able to understand me. I really appreciate the opportunity to come and talk to you. I'm extremely passionate about health. Yeah, thank you very much.